good night. My name is Stillkenn Cruz, and today I am going to talk to you about mental health. It's common that if we listen to the expression mental health, we immediately imagine a person who has lost his mind, mad in the madhouse as shown in the movies, associated with lack of mental health. But these two words do go beyond of that. First, we will say that is mental health, and according to the clinical and scientific definition, it is a state of emotionally, psychological, and social well-being. This is quite related in our mood, since it defines the way we think, act, and face life, our control of emotions, stress, and make decisions of any stage of our life. So, we can understand from this that mental health is well-being, but what do we call mental health lack? It is there that we find the mental illness, which are quite delicate conditions that can affect much of our lives. And although most of these diseases have treatments and a history of fully rehabilitated patients, some have greater complexity and less likely recovery. It's necessary to take special care about with our health, not only in your body, but our mental health must be careful, not to have problems with your family or relationships, with society, with your learning, and others. The DSM is a manual created by APA, American Psychological Association, which explains all the symptoms that a mental illness can have, and all the necessary characteristics to identify and treat problems such as depression, anxiety, disorders in the food, and post-traumatic stress and schizophrenia. One of these disorders or diseases is depression. This is characterized by episodes of sadness, lack of interest, tiredness, insomnia, and others. The depression can become chronic or recurrent and significantly hinder work or school performance and the ability to cope with daily life. In your most seriously form, can lead to suicide. If it is mild, it can be treated without medication, but when it's moderate or severe, the medications and the professional psychotherapy be needed. Another of these disorders are the bipolar disorder. It is set of most disorders characterized by notable fluctuations in the mood, thinking, behavior, energy, and the ability to perform activities of the daily life. This disorder affects the person for months or years in stage, where calm and normal behavior and interpreted between manic episodes and depression. The persons or the people that be this disorder alternates their mood between mania or hypomania or depression, with sadness, inhibition, and ideas of death. There are currently different treatments to bipolar disorder, and in many cases recovery occurs. To achieve this or to do this, pharmacological and psychological techniques are used, among which the psychoeducation or interpersonal and social healing therapy stands out. Finally, one of the less known mental disorders, but also common, is the Asperger syndrome, which consists of a set of mental and different characteristics that are part of the autism spectrum disorder. Consists on an asocial personality, lack of empathy, unusual egocentrism, be an eccentric person, desire of loneliness, establishing routines among and others. This syndrome is a bit strange, since one of these main characteristics is an advanced development of the cognitive abilities. If you can see, the mental disorders are generalized by the lack of the mental well-being, and this can be avoided with a good habits to take care of our mental health, and adequate rest, good food, mental exercise, reading, and others that allow to keep our brain and our mind active and in a good health. Thank you so much. Good night. My name is Stillkenn Cruz, and see you later. Bye bye.